Hi, I'm Joanna. Welcome to your exciting laser day. I am going to go over all of your instructions and kind of what to expect in the laser room. You'll also get a sheet with your instructions on it so you can certainly follow along and make any notes that you wish to. So today we'll get you all checked in. Once you're checked in and ready for the laser room, the doctor will bring you back, put in lots of numbing drops. And believe it or not, the laser room is the easiest part of your whole journey. If you have any last minute questions for the surgeon, please feel free to ask. When you're in that laser room, it's only 15 minutes. You'll be laying down and your two jobs will be to breathe and watch the blinking light. We've thought of all the worries. We are gonna have an eyelid holder for you so you don't have to worry about blinking, and the laser even tracks your eye movement. Most laser treatments are over and done somewhere between 5 to 20 seconds. So the strangest part to the whole procedure is when we create the flap. You're going to feel a little bit of pressure and that vision will go dark and sparkly for about 20 to 30 seconds. Don't let that scare you. That's what we want to happen. The rest is just a strange, cool light show. And as we are doing the laser procedure, if the blinking light ever appears like it goes out of focus or you don't see it very well, just keep feeling like you're looking straight. The staff is going to make sure you're doing exactly what you're supposed to. And then the doctor will be putting in all of your eye drops, so you won't want to put in any eye drops until after the nap. When you sit up from the laser bed, you're going to notice it's kind of like seeing through swimming pool water vision. But you can see to get to your car, and do use them only to walk. Once you get in the car, keep them closed. Use those eyes to get back into the house, and then straight to a nap. We'll offer you some Tylenol PM, that'll help with that. But even if you cannot sleep, you need to keep those eyes closed for the next 4 to 6 hours. Your numbing drops are going to wear off in about 15-20 minutes. And you know those eyes are going to burn, sting, tear, feel like there's something in there. The best remedy is sleep, but again, even if you can't sleep, the most important thing I'm going to tell you is to keep those eyes closed. So after the nap is over, you're going to be feeling better. And we're going to send you out in some of these sleeping goggles. These are just to protect you from yourself. You'll want to wear these the next 7 nights anytime you're sleeping. And for some reason, if you like to pull these off your face at night, you could go get some medical tape and put a piece of tape on each side to help it better stay in position. Some people need to do that, some people don't. We'll also give you some sunglasses as well. And then for your eye drops, you know, again, I don't care which eye drop goes in first, but I do care that you space them by a couple of minutes. The antibiotic here is going to be in a blue cap. It's called Predmoxy. You'll want to shake this well. This will be 1 drop 4 times a day for 7 days. So the easiest way for me to remember is breakfast, lunch, dinner, bedtime. So if you've had your procedure in the morning, you probably only need get a couple more sets in. And then depending on the afternoon, you might get a late dinner time or maybe even one right before you go to bed. And some people don't get anything in until they wake up the next morning. That's fine by me. But we want to count day 1 of the 7 days that you're using this starting the next day after your procedure, even if you put some drops in today. And this one, even though it's going inside your eye, you might experience a strange taste in the back of your throat. Totally normal, not very delicious. And then your new best friends are the artificial tears. So we'll give you 3 boxes. They come in single vials. Once you take the top off, the top does re-snap back on so you can get a few uses out of them. You'll want to stay on single vial tears for at least the first month. If for any reason you run out of these, any over-the-counter pharmacy has them. Doesn't have to be this brand, but do make sure it's name brand and it comes in a single vial. After about a month, you're okay to switch to a bottled tear. Again, never for redness, only for dryness. Make sure it's a name brand. But you know, dryness may not be a feeling. It could be, I don't feel like I'm seeing as clear as I think I should be. My vision is fluctuating. Or you might even feel like there's something in your eye. Those are all kind of symptoms of dryness. So once the nap is over, these are going to be every 1 to 2 hours or more. You cannot use these enough. After a few weeks, play with them. Try every 3 to 4 hours. But if vision ever gets foggy, step them back up again. The only drop that I do not want you to do today is going to be a thicker gel tear. And in the mornings, you're going to notice you're blurrier and you're drier. So this one's going to help to coat the eye while you sleep. So put that in starting the next night after your procedure. Some patients even like to put it in before they hop in the shower in the morning. That's totally fine by me as long as it's the next day after your surgery. Just use this till the bottle is gone. And then we've also given you a vitamin called Hydri. This is also to help with dryness. You'll want to take 2 with breakfast, 2 with dinner. If you ever forget your breakfast dose, you can go ahead and do the lunchtime and then dinner time. If you forget your breakfast or lunchtime dose, you could take all 4 with dinner, but they do work more effectively if you space them. So this is a 30-day supply. Just take it till the bottle is gone, again with food. And then today, if you wake up and notice any red spots on the whites of your eyes, those are no big deal. They take about 2 to 4 weeks to go away, but they will go away if you see any. And then showering and bathing is just fine, just no swimming pool type water for the next 2 weeks. No eye makeup for the next 7 days. And then exercise is fine, running's fine, lifting's fine. Just careful of trauma, bumping, rubbing, squeezing. If you get anything in your eyes, just flush it with a bunch of tears. We will have an emergency after hours phone number for you to reach us. An emergency would be, I'm in a lot of pain, or you notice discharge other than what the antibiotic drop puts in the corner of your eyes. And by the way, if you do get that, nice clean hands and just gently clean in the corners. We don't want you rubbing your eyes. Always reach for tears when you feel like you want to rub. And if it gets into allergy season, they make great over-the-counter allergy eye drops that we can recommend for you as well. And you know, LASIK is one of the safest, easiest, most accurate procedures that you can go through on your body. You have a very experienced surgeon who's going to be helping you today, and we thank you again for choosing and trusting TLC. Thanks so much. Enjoy your eyes.